everybody. Welcome back to another episode with the Psych NP Group. As always, I am the Curious Psych NP. We're joined by the Psych NP and Life of a Psych NP. And you might notice that today we have a very, very special guest. Today we have Talia, the Psych NP student, who's actually going to share with us her journey about how she decided to get into psych and what her experiences are currently like. Okay, and without further ado, Talia, why don't you tell us a little bit about yourself?
Hi, I am a Psych NP student. I'll be graduating in a few months from now. My background is in emergency medicine, medical and psychiatric emergency medicine for about 4 years now. I did start in a neuro ICU as well, so I don't have the traditional like inpatient psych experience that many people do before nurse practitioner school, but I do have some as well, and I'm excited to talk about it.
Cool. So I know, before we get started, I know that Talia, you actually have like a really interesting personal connection to psych, right? Is that what got you interested in this? Could you talk a little bit about that?
Yeah, so from an early age, I've been drawn to psych. I mean, I have personal experience in my family. I grew up from the age of 10. I had an older brother, about 4 years older than me, that developed like, it started with like substance abuse for many years. That developed into drug-induced psychosis and schizophrenia. So he did eventually pass from complications, but for about 15 years, it was a journey of just having my brother like struggling with mental illness. So I was introduced to this population from a very early age. I mean, I grew up visiting him in group homes, and he was on the severely mentally ill spectrum. So that kind of sparked my interest because, you know, I never saw him as being really sick. I just saw him as being my brother, and I loved him so much. So, you know, when I see psych patients now, and, you know, people tend to be kind of nervous around like severely mentally ill people. Like, I think commonly you could see homeless people on the streets, or and then if you don't have experience with that population, you can be kind of nervous. But I always felt very drawn and comfortable around patients like that, or people like that. So that's kind of what drew me. I was like, oh, I feel really comfortable, and you know, everyone has a story, everyone has struggles, but we're all human. And I just wanted to be around that population because it's so gratifying. Yeah. So did I answer your question?
Yeah, no, that's perfect. Which kind of leads me to another question. I know that you have a very personal connection with mental health. So how did you go from that to working in emergency medicine and then deciding you wanted to be a Psych NP?
Yeah. I didn't go into emergency medicine knowing that like Psych NP was my route. It was in the emergency room where, you know, I would reflect on my day and all the patients I saw, from cardiac to renal to psych patients. You kind of see everything there. And I started noticing a trend that like my most impactful patient interactions were with the people coming in for psychiatric issues. So I noticed that I was like very drawn to those patients, and I through my own, you know, self-work after my brother passed, I was seeing a therapist, and we kind of like worked through everything. And she was like, you know what, you know, life experiences happen that kind of lead you into different directions, and I think you would be great at it. Like, follow your passion. I was really nervous because we'll talk about it could be very like taxing field, and you really have to be self-aware of like your own boundaries and your own experiences coming into this field, because it could be heavy sometimes. So yeah, it's a journey. We're all working on it and figuring out what works best for us.
And you bring up an interesting point, and a lot of times that's what people fear when they talk about psych or working with psych patients. A lot of people don't realize there's a lot of like transference, countertransference type things going on. So how do you protect yourself from being too emotionally attached to, like, say, a patient who's very similar to your brother's backstory? What do you do to help yourself?
Yeah. Let me think about this for a moment. I definitely think like a couple years experience in nursing in general, before getting into this field, like you work on that and you notice trends of like when you're getting too close, and we're all human. We're going to have those moments of being there, like hitting a chord in our hearts, like that reminds you everyone has their own story. So something's going to happen, and sometimes you'll be very impacted by patient stories, and that's okay too. That kind of reminds us that we're all human, you know. But yeah, it's a constant, like you have to check in with yourself often. How I do it is like when a patient's story hits me harder, for example, which doesn't happen too often, but it does definitely. You can kind of recognize it, acknowledge your feelings, but ultimately you're there for your patient and it's about them. So you being very self-aware of like what feelings you're experiencing, what you're experiencing, observing and kind of like letting it pass, and then focusing on the patient again, because that's obviously what we're there for. Yeah. So, and obviously self-care and not trying to bring home emotions as well. Like that's something you got to work on too. So for me, it's like I'll exercise to like get my day like out before coming home or bringing it home.
That's great, and I'm definitely. I mean, we talk about self-care a lot. I feel like on this channel, that's something that we don't do enough for ourselves. I'm really glad to hear that you do take steps for yourself to take care of yourself. That's really important to increase your longevity in this career, because it is hard. It is hard. And so I guess my last question would be, how do you feel like your experiences have, like, because even within psych, there are like subspecialties. Do you feel like your experience at all has influenced or impacted maybe your interests in specific fields or specific populations within psychiatry?
Yeah. So you also, like, I've gone with the flow of my experiences. Like in my emergency medicine background, I was in an inner city emergency room, so I saw a lot of the severely mentally ill patients and a lot of homeless patients. And then I've also worked up at another hospital that dealt with the prison population and agricultural workers of Central California. So so my experience is in the severely mentally ill, that those are the people usually coming into the emergency department. So I've just had positive experiences, and then my life experience as well, like having my brother who, you know, was that ill. That's just where my interest peaked. But you're always what's amazing about this profession is that you're always growing. Like now I have clinical with the teenage adolescent population. So I'm like, oh, I love that too. So yeah, you'll find your groove, and it's kind of the experiences that you make for yourself, and then you kind of what you're matched with, and you just go with the flow. So
it's not necessarily what you think you might like. You might have an experience and you might be like, oh, I didn't know I wanted to do that, but that's really interesting.
Yeah, definitely. And then sometimes, you know, you're not locked into a field, which is amazing about our profession, is there's so many things to do. So yeah, I may think that sometimes working with the severely mentally ill can be taxing. And like, I could see myself, it's what I want to do now, but you know, there's so many opportunities in our field that, you know, you could move on or go into teaching or go into a different population. So that's what's really great about this profession as well. There's a lot of opportunities.
Awesome. I'll pass it forward to the Psych NP or Life of Psych NP if you guys want to had any additional questions.
Yeah. So yeah, Talia, thanks for sharing. You know, I know talking about like your personal life and kind of how you came into the psych field. You know, sometimes it's not that easy to talk about, but I mean that was a good story. You know, I think for a lot of us, we all kind of, you know, we all have our own history with like mental health. And for me, you know, just like a small backstory, you know, my dad was an alcoholic. He was drinking every weekend. He was like never home. There's a lot of things in like my life, but for me, there's a lot of bipolar disorder in my family. So there's a lot of things that I've seen just kind of growing up. And even though I think initially I didn't want to do psych, just because I didn't really think about it when I was in high school. You know, I wanted to be a college athlete. I was, you know, I wanted to be whatever I wanted to be, right? But, you know, now that I've like been in psych now for, you know, for the last 5-6 years, you know, I've seen like how there's a certain patient population I like to work with, whether it's someone that, you know, is dealing with alcoholism, because I've seen it firsthand, or just in general, like, you know, the adolescents to, you know, my age, around like the 30-year-old range. Like, I feel like I can resonate with them easier, and I like working with that population. I feel like when I speak to people a little bit older than me, like in their 40s or 50s, I try to give them advice, but then sometimes in a way I'm like, you know, these guys are older than me. They've had more experience than I've ever had. They're probably wiser than me. But, you know, for me, it's like, and I think all of us, and we kind of spoke about it before, Talia, before, that all of us have some sort of like history about with mental health, and it kind of affects us in the way we practice now.
And I will add to that, in this profession, a lot of people do have that history, but it's also okay if you don't have that history as well, if you don't have specific history with mental illness. It could be just sparked in you just being around society. I mean, it's everywhere. So you could also have that experience, or even just general nursing experience. I know a big question is, should I get psych nursing experience? But just having some experience and being exposed to the population is probably helpful for you, because you want to know if you're comfortable, you know, dealing with a lot of the issues that will be coming up. So.
Yeah, and I totally agree. I think it's one of those things where I think learning behaviors and being able to understand behaviors and kind of de-escalate patients, or connect to them in a certain way. I think that's the biggest thing, especially when going to psych. Like you mentioned, where you don't want to be burnt out. And that's a thing where a lot of providers that don't have any psych experience or any nursing experience will probably go down that road and being burnt out, especially dealing with like the severely mentally ill if they've never had any experience with. I know that you've worked in the ER. I know that you kind of dealt with this population of patients. So now that you're transitioning into the latter end of your NP school career, what do you feel like is the one thing that you wish you would have known or would have told yourself prior to going to NP school?
That's an interesting one. I probably tend to like hyper focus on what's going to happen, or where I'm going to be, or what what job I'm going to have, or I guess what I wish I would have told myself was that everything unfolds, and like as long as you're proactive and you keep that passion up and, you know, keep going, everything will unfold in like a beautiful way, and just like the way that it's supposed to in the moment. And then you can pivot if it's not for you, but don't worry so much. Like it's all gonna work out, and yeah, it's exciting time. So.
Yeah, and I agree. I think it's people tend to focus more on like, oh, I need to get things done in a certain time frame. I need to have a house. I need to have a family, have kids by a certain age. And people don't understand that we're also always changing, and our careers always changing. You just kind of have to go with the flow, like what you mentioned. So now that you're in your last semester of NP school, what do you feel like is the biggest learning curve that you've had when starting clinicals, since you didn't necessarily have the traditional route of having psych experience?
My weakness, I feel like, is, well, yeah, you could identify your strengths and your weaknesses. So my strengths, I feel like from my emergency background, was being comfortable with my patients and having that rapport, having good rapport with patients. So that's what's great about nursing experience. And then my weakness, probably from not having traditional like inpatient experience, was probably psychopharmacology. So as long as like I'm identifying those weaknesses and working towards it. And then also transitioning from RN to NP and understanding like, oh, no, I'm the resource. Like what are my resources? Like learning your new resources and just flow of work. It's a completely different role. So I'm glad I've had great like experiences and training and this 1.5 or 2 years to really set you up for that. So.
Everyone could learn medications. I think that's where you can learn that stuff. You can learn how to transition to being NP. I think it's just dealing with those behaviors and understanding how to deal with it. That's the biggest thing where people will have issues with, especially if they're not going into a specific field for the right reason. So that's, you can always learn those medications. You just have to read a book, have a good mentor, and you'll do great.
Yeah.
So
I guess another thing is just the navigating the business of healthcare too. I just understanding like insurance and just the job market. That's something that we're not really taught in school at all.
You're not.
So there's not that many resources on, you know, I scour the internet. I mean, I'm glad you guys have what you're doing. And so you're providing a lot of education to people. But yeah, it's kind of hard to navigate. So it's not like having friends or connecting or keeping in touch with people is really helpful.
For sure. Yeah, I think these schools, all NP schools, don't necessarily teach us what to expect, especially when graduating. They kind of paint this picture of you're going to get a job right away, you're going to be able to start working right away, but they don't tell you about credentialing. They don't tell you about how coding works. They don't tell you about how billing works if you want to start your own practice, or what to do with your money outside of just making money. You know, they don't really tell you like how to save, what to put your money towards, like 401k, Roth IRA, or whatever they need to tell you. I know they do that in medical school. They kind of they have certain classes that kind of gear you towards the latter end of your career. So, but it's tough as NPs, and I wish they would have told us that, especially during NP school.
Yeah, definitely. And then they also don't teach you, I mean, Joyce mentioned the transference, countertransference. They also don't teach you much about, you know, being aware of what your own emotions. I mean, this is heavy stuff that we're dealing with sometimes. So I haven't been taught like how to recognize, you know, when your own emotions are coming into play, or kind of that holistic aspect of being a new provider. So something you learn is all this you learn as you go. Yeah.
I find it interesting because I've spoken with therapist students before, and it's part of their curriculum to receive therapy themselves. You know, whether or not you have any issues, it's mostly just to recognize what that process looks like, and maybe to uncover some things that you didn't know that you had, because all those things are going to come out once you actually start working, and it might come out in ways you don't really expect. Like maybe you had some sort of trauma in your childhood, and you have a patient who's very similar to that kind of person who was the aggressor in your past. And maybe that's something you never really dealt with necessarily, but all of a sudden you're being triggered by this person. And so, I mean, that's a side note. Like, I think therapy is a great idea for everybody. But I think also in psych, when I first started psych, I thought there's two types of people that work in psych: people who have mental health issues themselves, and people who have personal experience with psych issues, like somebody in their family, one of their friends, something like that. And then what I found as I continued in my career path was like, actually everybody has something. And the people who really truly succeed in psych are the ones who can recognize that and are okay with the fact that they do have a little something. Like, it's okay. It's impossible to go through life without any sort of stressors or triggers at all. That's just impossible. Right. So, you know, it might not be like a full-blown schizophrenia or whatever, but everybody's been depressed once in their lives. Everybody's had some anxiety. And the people who are like, oh, no, I'm perfect, I never have any of that, those are the people who won't really survive in this field that I find. So I think it's a great, Talia, that you're so open about your journey and like your life and the challenges that you face. I think that's going to make you a really, really strong provider. And like the Psych NP was saying, like all those experiences help us become stronger providers too.
Thank you. Yeah, I mean, I want to commend everyone in this field. Like, sometimes you could be so busy with treating patients, and it's hard to recognize like the impact that you can have. But I've told my preceptor in the past, like, you know, you're not only treating that patient. Like, I remember growing up when my brother was like on his meds and well adjusted, like that impacted the whole family. Like, we would just love when he was doing well for a period of time. So that's a side of you don't see very often. You can see your patient's happiness or, you know, success, but it trickles down, and it's, yeah, so you can kind of remember that and be motivated by that as well.
That's a good
I think
reminder.
I think that's like the best feeling in the world, especially when family members comment or they can see the difference, especially with the patient. And then when the patient starts to see the difference, I think that's like the best feeling in the world. Obviously, it takes time. It's not like emergency medicine when you save someone's life and then the family member comes to you and thanks you. But it's like you see the difference over time. And then when they're back to work or they're back or they have their kids back again and have custody of their kids back again, it's an amazing feeling.
Yeah, outpatient is so much different than inpatient. That's why, like, I feel like, because I only had inpatient psych experience, and so when I was doing as an RN, you just see them. People might come back every once in a while, every couple of months. But then outpatient, I've been doing it only for about 2 years now. But like seeing these people from 2 years ago, seeing their growth and seeing how much they're empowered now to do things, and it's like night and day. And you get to see obviously how you basically know their whole lives. About their friends, about their families, their kids, how they're growing up. And obviously, medications are only one part of the whole spectrum, right? Therapy is also another big part. But I think in our field, just getting that satisfaction, right? Because people talk about financial, how much you make as a Psych NP and all these other things. But, obviously, if that's all you care about, you're going to be burnt out super quick. But with this kind of job and seeing all these people get better, and you just see like just the look in their eye and how they change and how excited they are to have like another lease on life. I think that's kind of like the greatest part about our job.
Definitely.
So Talia, in terms of, I know you have 3 more months of Psych NP school, so you're getting really close. But what do you feel like, I know you said you're maybe like the business side about things, but what do you feel like are you nervous, excited? What kind of feelings do you have? I know, the Curious Psych NP might have been your preceptor, but how do you feel about starting?
Oh, I'm so excited. Like even just going back to your last point, I think as providers, we have the ability to make a big impact on our patients and their lives and their family lives. So that's really gratifying. So I'm excited about that. I mean, it's different from emergency medicine, especially during this pandemic. You're just kind of like go, 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 and you just don't have time to like reflect and see the change that you're doing. So I'm really excited for that. I'm excited for work-life balance. I mean, coming from 312s on my feet during the pandemic, it's been kind of tough. So that's exciting. But like you said, like impact on patients is probably number one. I'm really excited about that. And then joining this field, it's definitely growing, but there's still like it's a new field. Like there's not much out about it. So kind of being part of this journey with everyone and everyone trying to get information and share stories. What I do love about this profession is that it doesn't feel competitive. Like I love that I have colleagues that are so open to talking and sharing their experiences and sharing their jobs and their connections, because I don't do well in a competitive environment. So I love that we could all lean on each other, and people like you guys are out there educating, and it's awesome. So
I remember when we met Talia. So me and the Life of a Psych NP met Talia about 2 years ago. I mean, she was, I think, I don't know if she just started school or did you start?
I think she was. I think you're about to start school.
Yeah, it's crazy that you're about to finish. It's awesome.
And you've been in the field for 2 years. You were just starting.
Yeah, I was a rookie and I'm a vet. It's crazy.
He's the GOAT.
Yeah, very exciting. And then we'll see how the landscape changes, like after everything that's been going on the last couple of months, like how our field will change and how we'll have to adjust as well. Whether it's going to be more telehealth or I don't know, more states gaining independent practice. So there's just a lot of out there. So it's exciting times.
So have you seen the difference on how patients treat you as an NP, student compared to an RN? Have you seen the difference at all?
Yeah, it's night and day. I mean, besides patients like calling you doctor, and I'm like, oh, I'm your provider. I'm a nurse practitioner student. I'll be your provider. But yeah, you're just like a little more in control of their journey and their care. So especially, and of course, collaborating with other physicians, depending on where you are, but nursing, I mean, I went into nursing to have that impact with patients because I loved people in general and just like I'm very strong interpersonal communicator. So, but with nursing, and I'm not downplaying nursing at all, it's an amazing profession. Like I've loved my experience. But it's kind of lost like how healthcare is now. Interactions are so fast, and like you said, like Fabius said, or that you what am I trying to say? You get to see their life more and what they're going through, and you know their family and or what's their life milestones as a provider. Where nursing, I don't see that as much. So.
And I like to ask that to a lot of people just because when I was a nurse, I was in the ER also and psych. So they treated us like trash sometimes just because they thought we were just their servants. So they tell us, oh, get me this, get me that, get me this. But now as a provider, there's like, they're treating us like gods, so to speak, because their care is in our hands. No, it's true because it's like they treat us in a certain standard and like they see us like, oh, we're providing all of the care. But realistically, nurses do way more than what we do at the end of the day. Like they're the ones who are there every single minute providing the care. A lot of what we're doing is kind of orders and just thinking about the bigger picture as opposed to kind of nursing. And that's how they treat us. Like they treat us like we do way more, but realistically speaking, we don't. And I love hearing the perspective because it seems like just as nurses, we were treated a certain way compared to how we're treated now. And it's way different.
You know why though, right? Why that is? It's a control thing, right? Because patients, they feel so powerless in that situation. So a lot of times they get very frustrated and try to act out to somebody who they feel like has a lower level of authority. So the provider prescriber is like way up here, and then like in nursing staff, caseworkers, you know, whatever, are like down here. So it's mostly them just like projecting their own frustrations with their situations. And I know this. I'm laughing because it's the same thing. So I work with a severely mentally ill population. I work with a lot of caseworkers, and so many times the caseworker will be like, oh my gosh, this patient's so agitated, they're yelling, they say they have so many symptoms, like these medications aren't working, you need to see them right away. And then I'll go talk to the patient, they're like, oh no, I'm fine. You're doing so great. Everything's good. Like I don't have
That happens all the time.
It happens all the time.
All the time.
You know? And so I think for my caseworkers, the burnout's probably very high because they don't get the recognition that they deserve. So I always try to validate my caseworkers for all the stuff that they have to put up with, because I feel like we don't, as providers, get a lot of it. Not to say we don't get it. We for sure still get it sometimes.
Yeah. But it's crazy because I get this all the time, especially working in crisis where they come in on holds, whatnot. I tell them I'm a nurse practitioner and they're like, oh, you're just a nurse, blah, blah, blah. But when they find out you're pretty much deciding what their plan of care is with the medications. And then all of a sudden they switch and like, oh, thank you so much. I appreciate it. It's like, bro.
The great thing with us though is we've been nurses, right? So we've already experienced what it was like in the field as nurses, right? So for us, as now we become a provider on the provider side, you definitely know what they have to go through day in and day out. So in terms of being like more empathetic and knowing what they had to go through, it's like we know that. So I think that also helps us as providers because we definitely know how the whole landscape is and how important nurses are. Now, obviously, we are important too, but we all kind of have a piece of the pie. So it's pretty important there.
I agree.
Yeah. It's definitely great having experience in healthcare before being a provider. Just there's so much to learn about the landscape of mental health. I mean, inpatient, outpatient, continuity of care. So just all experience in general is great.
Any other questions, Joyce?
I think we're all set. Well,
Talia,
I want to thank you again so much for taking the time out of your day to share with us your story. I hope all of our viewers will find it helpful and inspirational and just feel comforted by the fact that you don't need to be like, it's okay to have stuff in your life. All that stuff can make you a better provider, and all that stuff makes us who we are too. And we all have our own personal experiences with challenges and things like that. So Anybody else
Talia.
have anything to
Thank
say
you.
before I continue rambling?
Talia's the GOAT.
Yeah.
Go.
Guys. Yeah, good luck to everyone in their journey, and keep up the good work.
All right.
Alrighty, guys, we're all set. Make sure you
Deuces.
like and subscribe, and we'll see you next time.
Eric, cut the